Alright, this video is going to demonstrate the oropharyngeal airway, or the OPA. From the side angle here, we're going to look at sizing. So for the OPAs, you can size from either the center of the mouth here to the earlobe, or the corner of the mouth to the angle of the jaw. Typically, I like to size it from the corner of the mouth to the angle of the jaw. So as I size these, you'll see that there's a couple different styles. They all function the same. You'll just see that the suction track here is on the side, whereas on another one that I'll show you, it actually just goes down the middle of the airway. So for sizing it from the corner of the mouth to the angle of the jaw, you'll see that this one's just a little bit too long. It should fit somewhere right around in here. So we'll try the next one. Same design. You can see that that one's definitely way too long. This green one here is just a little bit short. We want it to come down just a little bit longer. So hopefully this yellow one's a good fit. It is a good fit. We're right at the angle of the jaw. You can see that this one has the track down the center so that you can suction down the center. So that's the one we'll use when we actually go to insert the oral airway. So the top view, or facing the patient, of inserting the oral airway. Contraindications to this would be if the patient has a gag reflex. Inserting the oral airway would cause the gagging stimulation to activate, or we could also cause a vasovagal response by inserting this too far as well. So with this, you'll insert the oral airway. There's no need to lube it up or anything like that. It just goes in. There's 3 ways that we can insert it. You'll want to open the mouth a little bit. The text and the PowerPoints talk about a cross-fingered technique, where you would stick your fingers in and kind of rotate open. I personally don't like to stick my fingers in anybody's mouth. You never know when they may clamp down, and you may be missing a couple of your fingers when you pull them back out. So I use the chin. You can kind of hook the inside of the lip too if you need to. Just stay away from the teeth, and kind of pull that down just a little bit. So you can insert it upside down, 180 degrees, and as you go in, you'll work on rotating it down so that the flange rests at the mouth or the teeth. So you can remove it just by pulling it straight out. You can also do the 90 degree, so you can put it in sideways so that the tip is against the cheek, and as you go in, you'll rotate it down. And same thing, the flange rests against the teeth and the lips. And then you can also do straight in. You can grab the lip, pull the jaw down, and just go straight in and insert it that way. The only thing that you have to be careful about if you insert it straight in is that you have a clear view to the back of the airway, and that the tongue is not being pushed in along with the distal tip of the oropharyngeal airway. And then to remove, just pull straight out. One thing to remember with kids is that you cannot use the 180 degree method, because the tip rests at the soft palate of the upper airway. So if you use the 180 degree method with kids, we can scrape along that soft palate and tear that up. So you can use the 90 degrees with children, or you can go straight in. We just can't use the upside down method.